Hi, I'm Sarah Decker. I'm an OBGYN physician at Rutland Women's Healthcare. I always feel like every time I deliver a baby that I've done something really meaningful and that I really, my training and my skills have come together to have a healthy mom and a healthy baby and, help this little family on their way, and that's something that I really love. I also think that every time I talk to a woman about contraception and get her something that's going to work well for her to prevent pregnancy so that she's pregnant when she wants to be pregnant, when it's right for her and her family, and help her have control over her reproductive life, that I think makes me feel like I've done something important. And then, anytime you can really help a woman understand what's going on with her body and explain treatment options and help her feel empowered to make decisions to make her life better, I think that I get that same sense that it was all worth it. What is one of my best moments as a doctor? As an OBGYN, a lot of the things that pop to mind are delivering babies. The first time that I was there at a delivery and realizing this is what I'm going to end up doing with my life. After coming here to Rutland Regional, the first time that one of my colleagues, one of the nurses that I work with, chose me to be her physician and delivering her baby, that's just that trust, knowing that they know what's going on at every step in the process and they trust me. That's an incredible feeling. I've been really impressed since I came here with how collaborative it is. I work the most with the ER physicians, who I think are just top notch here. They really do a great job for my patients, and I think they're very thorough, and I never mind being called by them because I know it's going to be something that we need to work on together. And whenever I have to send a patient to the ER, if I know that my patient is there, I know that they're going to be well taken care of. So I have to give a shout out to the ER physicians and the ER team. The physicians in the community at the community health centers of Rutland Regional, and as well as the other primary care physicians that refer to me, I think they take great care of their patients. I'm always impressed by how far the workup has kind of gone already when they come to me, and the knowledge that the patients have about kind of what's going on with their bodies by the time they come to me. And whenever I need to communicate with a primary care physician about pre-operative planning or anything like that, I feel like the response is always wonderful. I like coordinating with the pediatricians. That happens a lot, especially since one of my passions is birth control, and so we have a lot of conversations around that, and I've enjoyed those relationships. And then on the other side of things, the pediatricians collaborate with us a lot on labor and delivery when we have babies that need a little extra love and care, and so I like collaborating with them on that too. So I've been really impressed with the physicians within the community and how collaborative the atmosphere really is. People need doctors to worry about them, nurses to take care of them and worry about them, and that's what RMC's role is. I think we're a community hospital where people work, and people who work there are going to take care of you as one of their community and as one of their family. And that no matter what happens in the greater scheme of healthcare, that's always going to be important. And I think that that's where we know that. We know that we're not a big tertiary care facility, and we're not trying to be. But I think that the most important thing that we have to offer is that quality, excellent care with caring and compassion, because we're in your community too.